coBRIM study is a randomized phase 3 study which compared BRAF inhibitor, a combination of BRAF inhibitor, vemurafenib, and MEK inhibitor like cobimetinib versus vemurafenib plus placebo. Enrolled almost 500 patients, and the endpoint of the study was progression-free survival, investigator assessed, and second endpoint overall survival. During the meeting, we had an update about the progression-free survival and some interesting biomarkers analysis. The progression-free survival confirmed the impact of the combination on the outcome of patients, and at the moment is 12.3 months versus 7.2 months of vemurafenib in monotherapy. So a good impact with almost 70% of response rate versus 50%, there is a 20% of additional response with the combination. At this moment, we don't have the data in terms of overall survival. We will have this data in a few weeks for the end of the year, but from the data that we had at cutoff analysis, there is an hazard ratio of 0.65. That this means reduction for death or progression of 35%. About toxicity, the schedule is was well tolerated. The most frequent grade 3 and 4 with the cutaneous rash, the photosensitivity, the increase of liver toxicity, but in general, the side effects were very well managed, and the majority of cases were grade 1 and 2 and treated by just treated the symptoms, and sometimes with those discontinuation, then those interruption, then restarted. In some cases, we lowered dosage, but the median duration of treatment in combination was almost 10 months. So this means that was close to the value of the progression-free survival. This means that was very well tolerated. An important news reported just a few hours ago is that the mutational analysis, in case of the presence of additional mutations, there is no impact on the action progression-free survival of the combination regarding progression-free survival and response rate. So also in patients with additional mutations, we had a similar progression-free survival and response rate. And another important finding is that the PTEN loss, an additional mutation, can affect monotherapy but not the combination.